Hello, my name is Surya, registered nurse. Just today we are going to discuss about the cranial nerves, coming under the topic of central nervous system. So I hope you're all keeping good and well. And just in case if you want any particular topic discussion for your upcoming RRB or NORCET examination, pop it in my comments and I will get back to you soon, as soon as possible. Yeah. So I work as a registered nurse in here and I thought I just want to have a small discussion with you again about the cranial nerves. Okay, so coming to the cranial nerves, we have 12 pairs of cranial nerves. So in case if they ask you the questions like what are the number of cranial nerves do we have, and the options come up 12, and the 12 is not the answer because we don't have 12 cranial nerves, we have 12 pairs of cranial nerves. One of the most important thing which is going to be getting confused during the exams is the 12 pairs. We have 12 pairs of cranial nerves in total, and here I have listed the names of these 12 pair of cranial nerves: olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, vestibulocochlear, glossopharyngeal, vagus, accessory, and hypoglossal. So these are the 12 pairs of cranial nerves. So I would just recommend you to learn it in this correct order because these Roman letters, what is written beside the name of these cranial nerves, are very important as well. Because I remember in one of the questions they have asked about that even the name of a cranial nerve when the number was given in the question. For example, what is a cranial nerve number 3? It is oculomotor. So, in order to know what the name of the cranial nerve, depending upon the number, we should know both. We should learn this in this same exact order. I know we have very much of mnemonics available in the Google to learn it in the order. Here is one. I got this from the Google. An old Olympus towering top, a Finman German viewed a hope. I'm not sure if you can learn this by heart because I will not be able to learn this. I think it's very hard and it's harder than exactly this thing. So what I learned when I was in college is one of one of our Tamil teacher asked for very good vada and halwa. I don't know how people can relate to that, but to me, it was very, very helpful when I was studying in my university. I always learned it this way. One of our Tamil teacher asked for very good vada and halwa. So I learned it that way. So either you can learn it that way. One of our Tamil teacher asked for very good vada and halwa. You can either learn this way, or if you have another mnemonics with you, which is more easier, you can do that as well. Okay, so now I'm going to have a discussion with you about all these cranial nerves written here. So, when I was saying about the names of the cranial nerves and what is the importance of these Roman letters here, did you see this S, S, M, B here? What does that mean? This means if the cranial nerve is sensory or motor or both. Some cranial nerves are sensory cranial nerves, some are motor, and some are having the responsibility of both sensory and motor. So, identifying or understanding or learning this is also very important because I have seen a question, I don't remember what exam was that. I have seen a question which is showing up like among the given options, which is not a sensory cranial nerve. That was a question once. I don't even know if that is a state examination or a central examination, but I'm sure that I have seen that question somewhere. So if a question come up like that, that among the given cranial nerves, which is not a sensory, and the option is olfactory, optic, abducens, and vestibulocochlear. So the answer is abducens because it is not a sensory nerve and it is a motor nerve. In order to know that this is abducens, we should know what is sensory and what is motor and what is both. So to learn that, there is another mnemonics which was given in the Google, which I will not prefer to study. This is actually a very good mnemonic if you want. Some say marry money, but my brother says big brain matter more. It's a good mnemonic, but to be honest, I will not study a mnemonic for this because our exams, whatever this MCQ coming up in the central government or in the state examination, we don't have time for remembering all the mnemonics. That time when we are sitting in the examination, we are already stressed and we have lots of things going on behind our head, and then we don't have time to remember all the mnemonics, and that time you will feel like, why did I learn all these mnemonics? Why did I not learn it directly? So in order to help you with that, I just think the way um, I study the name of the cranial nerves with obviously with this mnemonic. One of our Tamil teacher asked for very good vada and halva. I learned that because I wanted to learn it in the order. But for knowing about the sensory and motor cranial nerves, I would just say I will study like sensory is 1, 2, 8. First one, second one, and eighth one is sensory cranial nerve. This is how I study. I rather than going with the mnemonics, I would just study with sensory is 1 to 8, and I will not study motor because that's too many. I will study rather. I'll study both. Both is odd numbers 5, 7, 9, and then even number 10. So I think this is more easier. Whatever you prefer, you can go with that. So sensory is 1 to 8, both is 5, 7, 9, 10, and the rest is motor. Okay, now we got an idea about what is the name of the cranial nerves and how we are going to learn the cranial nerves in order, and what are the sensory cranial nerves and what are the motor and what are the both cranial nerves. So sensory is 1 to 8 and both is 5, 7, 9, and 10. So this is a vague idea of cranial nerves. Now I'm going to tell you what is the responsibility of these cranial nerves in our body and what are they going to do and how they're going to help us in the proper functioning of our brain. So first thing is olfactory. Olfactory cranial nerve is the shortest cranial nerve. Very, very important. It is the shortest cranial nerve among the 12 pairs. It is the shortest cranial nerve. The function of olfactory cranial nerve is the smell, like olfactory. We all know it is smell. And then the one coming as optic. Optic helps in for vision. Oculomotor. Oculomotor is a motor cranial nerve. Motor means the movement. Yeah, it helps in the movement. Oculomotor cranial nerve helps us in the movement of our eye. Then comes the fourth one is trochlear. Trochlear cranial nerve is the smallest and thinnest. Yeah, trochlear is the smallest and thinnest cranial nerve among all of them. So remember, olfactory is the shortest cranial nerve, where trochlear is the smallest cranial nerve. Olfactory is the shortest, but it is not the small. Trochlear is the smallest cranial nerve. And trigeminal. Trigeminal is the largest cranial nerve. Remember G here and G here. Trigeminal is the largest cranial nerve. Abducens. Abducens is the cranial nerve which help us in the lateral movement of the eyes. Lateral movement. Abducens. Abduction means what? Abduction. Going away. Yep. Adduction means coming together. So abducens is the particular cranial nerve which help us to abduct our eyeballs, like looking on the corner, looking at this with the side view, looking at the side of the person on the side of our thing. So that is abducens, helps in the lateral movement of the eye. Then comes the facial nerve, which helps in all our facial expressions and movement of the eye and all. Then comes vestibulocochlear. Cochlear, we all know it. Cochlear is situated inside the ear. Vestibulocochlear helps us in maintaining the equilibrium or balance of our body. Then comes the glossopharyngeal. Glossopharyngeal, once there has been asked, I don't remember which exam it was. Anyway, it was been asked which cranial nerve is responsible for gag reflex. So glossopharyngeal nerve is responsible for gag reflex. Glossopharyngeal nerve is a nerve responsible for gag reflex. And comes vagus nerve. Vagus nerve is the longest nerve. Yeah, it is not the largest nerve. Largest nerve is trigeminal, G and G. Remember, trigeminal is the largest nerve. Longest nerve is vagus nerve. Vagus nerve is the longest nerve, not longest nerve, longest cranial nerve. Longest cranial nerve is vagus nerve. And longest cranial nerve, vagus nerve, helps in the phonation. Phonation means production of sound. Vagus nerve helps in the phonation. Then comes accessory. Accessory nerves helps in the movement of neck and shoulders. Neck and shoulders. Then is hypoglossial. So glossial. We all know glossitis. What is glossitis? It's the inflammation of the tongue. So hypoglossial means helps in the movement, all the movement of the tongue. Helps in the swallowing also. Helps in the swallowing, helps in the tongue. But the gag reflex is also always glossopharyngeal. So did you get an idea about the functions of cranial nerves? Olfactory cranial nerve is the shortest cranial nerve. And trochlear is the smallest and thinnest. Trochlear is the smallest and thinnest, whereas trigeminal is the largest cranial nerve, and vagus is the longest. Vagus is the longest, trigeminal is the largest, and abducens help in the lateral movement of eye, and facial nerve helps us in the facial expressions. Vestibulocochlear helps us for equilibrium and balance. Glossopharyngeal helps in gag reflex, and hypoglossal helps in the movement of tongue. Yeah, and vagus nerve. This is asked which nerve helps in the production of sound or phonation. It is vagus nerve, which helps us in the phonation process or the production of sound while we are talking. So these are the basics of cranial nerves. I hope you got an idea. And just in case if you need any particular classes or any particular question discussion for your upcoming RRB or NORCET or P or state government examination, let me know and we will have a discussion about that as well. Thanks for watching and support, and please support me, and then bye bye from Surya. Bye bye.